listening to Southpod, Rise of a Region, hosted by Stanfield Gray and John Yarian.
Greetings and welcome to Southpod. I'm your host, John Yarian. We are recording at the Dig South Conference. We're here in the Gilliard, and if you're not, then shame on you. But I am joined today by Stephanie Sargent, Vice President of Product Development Quality at SE Healthcare. How are you?
Good, thanks.
Well, it's great to have you, and folks get these podcasts at different times, and the way they consume them, they wouldn't know that we record many in one day. But here at the conference, we do a lot of podcasts. We've only just now gotten into healthcare, which seems weird to me, because I can't think of a vertical category and industry more interdependent and facing more challenges related to technology and technology implementation. Is that a fair statement, or am I overdoing it?
You could not be more correct. Yeah, and it's we're thankful that you do have a HealthTech session during the conference. We would love to see a larger presence in terms of conversations around how technology can improve healthcare. Absolutely.
Yeah. Well, help us understand what you do every day and your relationship to the healthcare system, just so we can get oriented before we dig a little deeper.
Sure. So there's a couple of ways we help providers. Number one is we offer a patient experience survey platform that helps practices, physicians, providers more deeply understand their customers. Voice of the customer is incredibly important. The more we become a consumerism-focused society. So if you're not paying attention to the voice of your customers, you're not going to be well prepared to transition in this weird, wild west healthcare that's happening.
Are we talking about self-reported patient experience data, or are we talking about capturing more than that, or both?
It is self-reported patient experience of care, but there's also measures in there that describe how well providers engage with their patients. And so I don't know if you're familiar with the buzzword patient engagement. The whole crux of that is that patients are not recipients of care, but they're participants in their care. So it's really important that providers are doing things in their practice that support shared decision making, that they communicate well, that they explain things well, and those are all the basis of really quality and safety and really engaging patients in their care. So it's not just is your waiting room comfortable. It's way more than that.
Well, how do you capture it, though? I mean, I understand what you're saying, and that engagement is critical to, for example, execute prescription directions accurately, to undertake physical therapy, other exercises that would reduce, re-injury. How do you get a sense of whether or not that's occurring, whether or not it's effective? How do you capture that in order to help physicians even track it?
Right. So there's no better source of that data than from the patient themselves. So often there can be a great disparity between physicians or providers' perception of their care and what patients are actually recounting as their care experience. So it's the truth. It's the naked truth.
It's the hard truth of what's really going on. And is that truth revealed through some sort of a platform? Is there something to log into? Is there a digital component to this that ties it together?
Exactly. So they, the practice or the hospital can log into the web-based platform and look at their most up-to-date patient experience, statistics on any given day. And the idea is that you're not just reviewing the data, but you're actioning on it. That you actually, put new processes and systems into place to improve the care that you deliver. So it's a huge piece of it.
And does that technology have to connect with their own internal proprietary systems for patient booking or medical records or anything like that, or does it just sit in a vacuum on its own?
It could do either.
Oh yeah?
So it could integrate with that practice's administrative billing system or their electronic medical record, but our platform can also just sit out singularly outside of that as well.
So now that we have a sense of what you do, and boy does it sound complicated, congratulations, it sounds difficult, how did you get to this? What was the journey that brought you to sitting down with health systems and providers to deliver this kind of solution?
So we do a little bit more than just the patient experience. We also do the traditional healthcare consulting where we can provide a top-down, bottom, sideways assessment of the quality of care that's provided within a practice. So we do that too. But our company is founded by physicians and clinicians and nurses, and the individuals like myself and people, the sharp point of healthcare are the ones that understand it most intimately. So that's how the company.
Are you a
was
prior
founded.
practitioner?
I'm a nurse.
Oh, okay. So you know both sides of this, or more than that, really. You know how it works.
Sure.
That's really interesting. What took you from care delivery to consultation around the practice of care management and optimization?
Yep. So I did patient care for 15 or so years, and I spent a lot of time thinking about and experiencing the problems in healthcare, honestly. And so I left the bedside and did some Lean Six Sigma project work in the hospital, actually. And so that afforded me the opportunity to really dig in and be a problem solver and be, part of a solution. Did some patient safety program manager stuff. Anyway, that's how I landed into the job I have now, doing consulting.
Well, you blew past something interesting there, and I'm going to pick at it if you'll allow me. So you suggested you were in direct patient care, you were nursing, and then, quote, did some Six Sigma stuff and other stuff. It just works like that? Anybody listening in nursing can just do some Six Sigma stuff?
No, it's a little more involved than...
Okay. Help us a little bit. Give me a little bit.
Okay. So it's a whole problem-solving methodology, and if you're...
No, I know what Six Sigma is. I'm saying, how did you go from self-identifying as somebody who, I am a nurse, I work on a floor or in a patient group, to I'm now all the way in administration management. Did you just wake up one day and say, I want to do something different, or?
Yeah, I left the bedside and chose to go back to school for a master's, and I was trying...
So there's a break here.
Yeah, so I was trying to set myself up for a new opportunity.
Yeah.
To get...
Okay.
Yeah.
So this is a really conscious career change. This is you saying, I'm going to take a step back, I'm going to go to school, I'm going to reconfigure this. Okay. That was that little space between...
Oh, sorry, did I make a big leap? I made a big leap.
Well, it's very impressive, but listeners might be curious how you just jumped through it. So how does your background in nursing influence what you do today? How does that represent itself in your work?
I speak the language, so I think that having worked very intimately in healthcare and being able to understand how to talk to providers and that I deeply understand their problems certainly helps in terms of credibility, but also, I understand it. I spent... Yep. I've been in healthcare for 25 years, so being a clinician I think is really important to understand the problems.
So a 25-year exposure in this kind of workspace, you probably have a great perspective on what's changed, right? If we were to take a primary care practice or a small regional health system, for those listening who are involved in technology and startups and software, they want to do something in healthcare, help them understand the change that has occurred in the way these people work and how they work with and communicate with each other.
Sure. Technology in healthcare is just booming, and the major problem is that healthcare can't seem to keep up with it. So a perfect example is when I started nursing, there were no electronic medical records.
Right.
We documented on paper. And now, I think, a nurse can go a whole week and never use a pen, not once. So, and EMRs are clunky and difficult and burdensome, and, not to say that there's a lot of good things about EMRs, because there are, but they're also a huge thorn in people's sides. So what I would say is, consider that as a problem that needs to be solved, and how could you lend to that solution?
Well, you make an interesting point. We're talking about electronic health records or medical records. EMR is the acronym we're using. And for a lot of us, when you hear about digitizing something or putting it into a virtual space, we think, oh, well, that's faster. That's going to be faster. That's going to be more efficient. That's going to be better. And inside of a lot of health systems, it hasn't looked that way. Not for any wrong intention, but because the complexities of that process, the regulations that govern it, right, I think are a big part of it. And then maybe speak to just all the data inputs. I mean, what do some of these things need to do, right, to fulfill the job that used to be done with paper?
Sure. So most hospitals, for example, they allocate 2 or 3 or even a week of orientation to the medical record when they have new hires. So, that begs the question, how many times have you heard that people have to take a 3-day seminar to understand how to navigate Amazon? So it speaks to the complexity, the over-complexity of EMRs. Now I forgot your question.
It's okay. We're talking about EMRs, we're talking about how complicated it is and all the data inputs that need to go into it. And I think we're agreeing that right now, for a lot of physicians and practice teams, the user experience is atrocious. It's really, really hard. It's difficult. And when you're really busy with that and you're booked to the gills with patients, you don't have a lot of time for, you said it 10 minutes ago, patient engagement, right? So talk to us about how what you do shifts that paradigm, right, and helps health systems focus more on engagement and quality of care.
So one of the things that we help clinicians understand is what their baseline is in terms of clinical best practices. That's a whole other segment of our service offerings that I haven't really gone into, but we do have a proprietary assessment that you first need to understand, are you in your practice executing certain well-established evidence-based practices or clinical guidelines or simple patient engagement practices. And I think for a lot of practice managers, let's say, when they review the results of the assessments, there's a lot of aha moments.
Sure.
And they understand where they have some great opportunities to improve efficiencies. So,
can you give us a couple examples of aha moments? I mean, what are some of the stunners you've seen over and over?
Yeah, okay. Let's see. One of the things that we do assess for to improve the quality of care is the culture of safety within a practice. So how willing are staff to report when an error has occurred? How willing are they to talk about problems within the office? Do the providers and the staff have a good working relationship? So all of these speak to the culture of safety within the practice, and hopefully it's a very open culture where people feel safe to speak up, they feel respected. A lot of dark corners, you can shine some light into some dark corners that you may have never otherwise known.
Sure.
If you can understand some of those types of things. So, in that case, it would beg the dialogue if they found out that, people are not comfortable talking about errors, then that's something that you have to address as a practice.
Sure.
Because otherwise it's a huge patient safety concern.
Sure. Company's headquartered in Charleston, somewhere else?
Our parent company is in Lancaster, Pennsylvania. It's a medical malpractice law firm called Staxton and Stump, and so we are the healthcare consulting division located in Charleston.
Terrific. But you live and work in Charleston?
Yes.
Okay, great.
Yeah.
And you all compete nationally, or is it regional? Is it more southern focused?
We've had international engagements. So, but mostly nationally.
And you yourself personally, are you truly Southern? Were you born down here?
Born in Indiana, raised in Columbia, South Carolina. But I've been here for 17 years, which almost makes me a
yeah, you got me beat. Yeah, that's a long time.
I think you have to be here 25 years.
Yeah. No, that's good. So the listeners love practical tips, things they can apply, things that might serve their careers. If we've got folks listening today who are maybe thinking about a career change like you pulled off, I'm going to give you two directions here. You can pick one. So they're either in a space that you were and want to redirect. What advice would you give them? Or if we have folks who are creating, inventing, entrepreneurs who want to get into the healthcare space, what advice would you give them? And you can do both if you want. But.
Yeah, I mean, there's so much opportunity. We recently just brought all of our software development team in-house. We had a company in Virginia who helped us build our platform and manage it, but at some point we needed to bring it in-house, and we have. And I mean, we're growing. We can't hire fast enough for what we need, because we have so many great enhancements that need to happen. So I mean, I think there's so much opportunity in the tech space. I was just talking to a girl who asked me the very same question. Mm-hmm. What would my advice be to her? And I think a great way to start is just to get into work in a hospital. Like, for example, the Medical University of South Carolina has a huge IT department, yeah. And their EMR has a huge tech support department. So I think it's a great way to get some great experiences to actually work in a healthcare setting.
It's a good reason to come to the Dig South conference, because you meet Stephanie in person and ask her advice, which is apparently what that woman did. Well, really fascinating. Thank you for your time, Stephanie Sargent, SC Healthcare.
Thank you very much. It was a pleasure.
Thank you for listening to Southpod, Rise of a Region, where innovators dish on success, failure, and a rapidly evolving South.